Yeba eba be breaki e de mamo PDS scandal ekoso chese ya arrest 4 individuals involved in that scandal. Abusia enrada yeba eba be breaki no de mamo President Mahama wa order Chief Justice Paul Bafuboni say a fast track high court no ye shase a prosecute amount for ewo and then dry mamo who say fast track high court tribunals no aye ready asisi asa enkofo na ye arrest omo PDS scandal 4 individuals omo ye involved na abusuya ye de omo kwa kudina eye tribunal court so fast track high court or na say omo case no ya fast track na say ya prosecute omo ntentema enye asem ketwa abusuya mom ye ko na ye nkonkoti ensema ekoso ewo political highway so efa PDS scandals 4 individuals ya arrest yomo any tribunals na ye de yomo kwa kuchina no mom yan ko na ye nkonkuti unsubscribe ya subscribe na hit on the notification bell so na be any update be I ever drop in one so once ebe to me akebi medamase
state in charge of government communications Brasibu Kwamankesi member of parliament Felix Kwachofosu has disclosed the Bureau of National Investigations, that's now BNI, last week arrested 4 individuals linked to the power distribution services, that's PDS, over the suspected transfer of funds believed to belong to the Electricity Company of Ghana, ECG. Now, these individuals, he said, and he put this on his social media handles sometime earlier in the day. We're going to put exactly what Felix Kwachofosu put out on his social media handles, the names, and then also what is going to happen next after today, this notification. And we'll bring in Adam Sananu as well as the co-chair of the Citizens Movement Against Corruption, and give us an indication of obviously when it comes to the fight against, that's the Operation Recover All Loot, oral, and then also what the expectation of the public is regarding this fight against corruption. And this is it. This is what Felix Kwachofosu put out there. I'm going to read it. It says the oral update, the Bureau of National Investigation arrested the following persons affiliated to PDS last week as part of investigations into the transfer of large sums of money believed to belong to ECG. Philippa Yensu, Viraj Fat, Sophia Koko, Justice Menka Premo. The quartet, that's these 4 individuals, have since been given bail pending further investigations. Mesano, appreciate you. Thank you for joining us here on the show. He's a co-chair of the Citizens Movement Against Corruption. After this announcement was made, they engaged public reaction and a lot more about what happens next. And then also the fact that the oral updates have not come in for quite a while. And I'm reading the reactions after this post was made, and in terms of the expectations regarding the prosecution of the Operation Recover All Loot cases. And many of persons who commented expected a lot more. Justified expectations, you would say?
Well, I think there's a rational basis for citizens to be wary of perhaps what one would call a flash in the pan scenario, where once in a long while something comes up and seems like some cases being followed up on. Obviously, the process that oral followed, for example, suggested to many that there was going to be a consistent approach, one that would provide citizens with regular information on number of cases, the investigations, the prosecutions, etc. But that's not happening. So I'm not surprised that your survey is producing these results.
Well, the reaction or the response that is given whenever this matter of the slow pace of prosecuting oral case comes up is that the persons in government, and including the Attorney General, his deputy, say that, look, these cases were going to be prosecuted within the boundaries of Ghana's judiciary, the courts. The process is slow or can be slow in a number of instances, as we have seen. And even though there are expectations of the speedy prosecution of these cases are subjected to the legal procedure, which can be slow in itself. That's the explanation that has been given. Zano.
Well, that may be true, but you see, if, for example, we know that Korle ended up with, say, 200 cases, one would be expecting that every 3 months or so, not more than 6 months, you have an update on these cases. Mind you, just when the government was getting into office, these things were pulled together. So a lot of, public media coverage. So to suddenly have a situation where citizens appear to be starved of information on the specific cases that were found, the investigations, the prosecutions, and the appearance that there's not much traction, especially to the extent that Aura was supposed to serve the purpose of being a deterrent. Having one here, one there, definitely does not deal comprehensively or robustly with the issues of corruption that were articulated during the campaign period and to get into government. And so there's a sense in which citizens have not been carried along, even if these cases are taking longer than usual in respect of prosecution. That information, the data, the statistics should have been provided to the extent that then citizens are clear in their mind that, look, investigations have been completed on 50% of these cases, 40% of them are in court, 20% of them are delaying. Not carrying along the citizens, and then once in a while having a case or two reported on, certainly is what you will be finding reflected in the kind of data that you've captured.
I say, and I want to hold on a bit for me. I want us to take a listen to the president, John Dramani Mahama, when he was delivering his May Day speech regarding the Office of the Special Prosecutor, the fight against corruption, and this special courts to be set up to deal with cases related to corruption. Take a look.
There have been legal disputes about the constitutionality of the Office of the Special Prosecutor. While some of the issues are pending appeal and Supreme Court interpretation, government believes that there is space for an effective Office of the Special Prosecutor with special powers of prosecution. Government has, through the Attorney General, laid a bill in Parliament to give legal effect for the setting up of regional tribunals. These regional tribunals will help to speed up the system of justice.
So this is the president's solution as proposed. It's very clear in his mind how the speedy justice delivery that the people expect can be achieved. Mazano.
Well, the president stands out when he speaks to be someone who is setting the standards. I mean, he seems to be a torchbearer. But you see, it's one thing to make policy statements on platforms. Converting or translating policy statements into action on the ground is something that if you don't have policy analysts who take it, identify the right sectors, the ministers, if you don't have a mechanism where the respective sector minister and his team are being pushed to ensure that this translates into action on the ground, then we will have the president saying a lot of things which people aligned with, subscribe to, but at the operational level, they are not translating and materializing into tangibles that citizens can say, yes, when the government says something, when the president says something, it's bringing the change we want to see. So there's a bit of disconnect. I think the president is doing well in terms of, especially when we talk about issues of anti-corruption and good governance, in setting the tone. But beyond the president who stood out, his rank and file, and sometimes the utterances of some of the other political actors around him don't they don't reinforce that confidence for many people. And so there's got to be that thinking around what do we do differently to get the results. And I think that's important.
I appreciate you for this. Thank you for joining us here on Ghana Tonight. That this strike has had on outpatients, that's earlier today, the withdrawal of the outpatient services and what we've seen over the period. Now, we're going to backtrack a bit just to tell you exactly how this impacted on members of the general public who went to the Korle Bu Teaching Hospital to access healthcare. The situation wasn't good. We had to speak to a few of them earlier today to understand exactly what was happening to them and what they had to endure as a result of this decision by the doctors to withdraw their services at the OPD. Take a look.
Me feel I don't know what side. I don't know if I drop him, I don't know if I'm not to cry, I can't call a 1,008.
I am coming from Dodowa. I spent 1,800 cedis on my transport. I am very worried with the situation because there is no doctor to cater for you. It's very bad.
Government must address the issue so that our brothers who are due for surgery can be operated upon.
After patients and the members of the general public to deal with this situation earlier today, as you heard some of them share with us, just a few minutes ago, we got this statement from the Korle Bu Doctors Association. They say they are formally notifying management and the public of the suspension of the strike action commenced this morning, Monday, 4th May 2026. The decision follows a meeting held in the morning and the assurances given by management to ensure laboratory physicians return to their place of work. So this is the issue. It's not about, they were not striking about anything to do with their salaries or allowances or the conditions of service. No, it was about some tough war, for the lack of better expression, that was happening in there. So now they say, according to this statement, that there's been assurances given by management that laboratory physicians will return to their place of work. They believe the peaceful coexistence of the laboratory physicians and medical laboratory scientists. So that's the two. So there are laboratory physicians and medical laboratory scientists, and these two were involved in this, professional tough war as to who exactly has control to do what at the central laboratory. And they say it's best for quality healthcare delivery. And by this letter, they are entreating all Korle Bu doctors and that's to resume outpatient services from tomorrow, 5th May 2026. So we spoke to the leadership of the laboratory technicians at the Korle Bu Teaching Hospital. They also had this to say about what led to this strike in the first place. Take a look.
They want to take leadership of central laboratory. They want to subject the medical lab scientists to their control. We are regulated by different councils. So to allow someone from a different council or regulator to superintend under somebody else is an affront on the law. So this is why we say we will not allow, and if that is what they are terming us, we deny them access to the lab, so be it. So
this is it, right? But the Korle Bu doctors, the leadership also spoke to the media about this entire standoff, which led to the decision to go on strike. That's the chairman of the doctors, Dr. Kweku Asare-Ofei. Take a look.
This problem has been back and forth, several committees working on it from the ministry to everywhere, and it's not being resolved. Somebody must take the decision that no, allow doctors and everybody who is working in a lab to come and work. You can't say, I will not allow. So we want that administrative decision to be taken. These days, doctors, because we also train through the labs, we're able to interpret the lab. So if you are sitting in front of me and you don't seem to have this problem that the lab is saying, I won't give you the medicine. I will ask you to go to a private lab and repeat. Then most of the time you see that the results from the private lab comes differently, which matches with the patient condition, and you confidently can treat the patient.
The national president of the Medical Laboratory Professionals Workers Union, Dr. Cephas Akoto, also criticized the doctors for questioning the credibility of the laboratory results. Take a look.
Misleading information in the system to the extent that a whole doctor can be on radio to say that we produce over 50% of the result produced from laboratory are inaccurate. That is very, very surprising. It means that the whole of Korle Bu has to shut down immediately for the national leadership of this country to investigate that information. They are on set lying to the whole public that we have physically threatened them to leave the space. We will pursue that.
Pursue that means they go to court?
It is possible because it's an issue of defamation. They have to clear our name.
So that's the leaders of the two groups who were involved in this professional turf war that led to this decision by the Korle Bu doctors to go on strike, which has now been suspended. So the suspension essentially is as a result of a meeting that was had today. There's been assurances given to the doctors, which the laboratory technicians also were not seated in, and also they haven't issued any statement as to whether these assurances given to the doctors is one that they agree with, they work with as well. It's a matter that we're going to be looking into quite shortly. But Dr. Thomas Anaba is a former director of the Greater Accra Regional Hospital. He is a member of parliament for the Garu constituency. Now, I want to find out what exists in other institutions, health institutions for that matter, because this was all between these two, the laboratory physicians and the medical laboratory scientists, those two, right? But is it a case with just Korle Bu alone, or these two groups of professionals also have presence in other health facilities, and what do they do in there? Doc, good evening. Thank you for joining us here on Ghana Tonight. I'm tapping into your experience in your former capacity as a CEO of the Greater Accra Regional Hospital, that's the Ridge Hospital, and looking at how things are playing out in the Korle Bu right now. Well, they've suspended the strike, but what persists at the Greater Accra Regional Hospital?
Very much. I think that every institution have a criteria for who to appoint to man what and who to appoint to manage what. What I know in Ridge Hospital, because I was the medical director there, I know that in the laboratory, we have what we call laboratory assistants who do basic laboratory. We have laboratory technicians who are a little bit higher. And then we have laboratory scientists, some of them even having PhDs in medical laboratory sciences. And then per the regulators, the act that governs laboratories and health facilities in Ghana, under the Ghana Health Service, we call it the Health Facility Regulatory.
Okay, I was going to answer my course or political highway. So a year 4 individuals are arrested or more. I just say there is much interesting moment ahead. The likes of Edinbi, Ebobo, Ebabonti, as Uncle Fono, NPP top gurus are almost no time and so Babeson, PDS scandal, and easy cry. But I must have some Japan cocotiza and some way at the MI gossip politics TV. So, Madam.